Hi, I'm Mona Soraya. I'm a medical epidemiologist and Associate Director of the Office of International Cancer Control and the Division of Cancer Prevention Control at the CDC. So the cervix is basically the lower portion of the uterus. Many women know that it's often used associated with childbirth or Pap testing, but they don't often know its function. And it plays a really important role in the female reproductive system. The birth canal is widened, and that's where the baby passes through, and it also allows the passage of menstrual fluid through the vagina. Well, cervical cancer is when abnormal cells start in the cervix, and they divide very fast and grow out of control, and these extra cells form a tumor. The risk factors for cervical cancer are many. The first and most important is the persistence of HPV. Other risk factors also include smoking. Smoking is felt to decrease HPV clearance. There is also long-term use of oral contraceptives. And I often like to think of women who are rarely or never screened. Not getting screened is a risk factor for getting cervical cancer. There is evidence that long-term use of oral contraceptives can increase the risk of cervical cancer, and then usually the risk goes down after the oral contraceptives have stopped. Poverty is considered a risk factor for cervical cancer in that a lot of women may not have access to get screened. That's true for all racial ethnic groups. No matter if one is Hispanic, lower poverty, there's associated increased risk, and it's felt to be an access issue. Having said that, there are some racial disparities that exist in cervical cancer. Hispanic women and Black women are more likely to get cervical cancer, and Black women have higher rates of dying from cervical cancer. In the United States, thankfully, due to cervical cancer screening, cervical cancer rates have really gone down markedly since the 1950s. Right now, in the United States, there's approximately 12,000 new cases of cervical cancer and approximately 4,000 deaths a year. But it is still felt that the majority of cervical cancer cases, probably over half of those cases that are around, are probably due to women not getting screened at all or not getting screened recently. Over 60% of cervical cancers that occur in the United States may occur among women who have rarely been screened, that means not screened in the past 5 years, or who have never been screened. The Pap test is basically a test that many of us may be familiar with, but it's basically a test that's used to look for abnormal cervical cells, and they're often done during the time during a pelvic exam portion of the well woman visit. Usually the provider, it could be a nurse or a doctor, collects a sample of cervical cells. In the past, one used to smear the cells on a slide. Now it's more modern, and it's in a little tube. And usually about 90% of Pap test results are normal. And if the Pap test is abnormal, a woman is encouraged by her clinician to get more tests over a period of time. And in most cases, an abnormal Pap test result does not mean that a woman has cancer. I was just going to mention that there's also two types of screening tests, the Pap test as well as the HPV test. The HPV test looks for high-risk types or cancer-causing types on a woman's cervix, and these use the same sample of cells that are taken for the Pap test, or a separate sample that's taken right after the Pap test. And a positive test result means that a woman has a high-risk or cancer-causing HPV type, and she should be followed closely as long as the HPV test remains positive. But a positive HPV test, just like a positive abnormal Pap test, a positive abnormal Pap test does not necessarily mean that a woman has cancer or will develop cancer. It just means she needs to be monitored a little bit closer. There's many guidelines on cervical cancer screening, and currently the Pap test can be used alone or with the HPV test. The Pap test is recommended for younger women under 30 to be conducted every 3 years. And then at age 30 or older, women have a choice of either using the Pap test alone with a screening interval or getting screened every 3 years, or they can use the HPV with the Pap test and get screened every 5 years. I think it's an individual decision to be discussed with the provider and the women in terms of their comfort level. We have noticed at the CDC that there is an increased interest over time among both providers and women to be using both the HPV and the Pap test. One of the findings from a variety of research that's been conducted here at CDC is that the finding that how strongly the provider recommends a vaccine makes a huge difference. And a strong recommendation from the provider would really help parents decide to vaccinate. As you know, the vaccine, the HPV vaccine, is recommended to be given between ages 11 to 12. And there are other vaccines that are also given at that time. So it should be raised as a routine vaccination, HPV vaccine, just like Tdap and meningococcal vaccine. So that's one of the initiatives that CDC is putting on in terms of encouraging providers to vaccinate with the HPV vaccine. Sometimes parents just need reassurance that the vaccine is safe and effective and it works. They also need the providers to be able to respond well about the vaccine. It's not an optional vaccine. It should be given routinely at the same time as other adolescent vaccines. Well, I see a lot of positive interventions. Hopefully, we can take advantage of them. First of all, there's one that's already taken place. There's a new vaccine that's been approved, the 9-valent vaccine, and it protects against more types of cervical cancer than before. So I think that has a lot of promise. I do think that we will hear more about whether less number of doses of HPV vaccine are needed. In the realm of screening, there is an enormous amount of promise in terms of the HPV tests and the type-specific tests that are being used for screening. I also anticipate that there may be more and more information about how to reach those women who are rarely or never screened, and whether the idea of self-collection with HPV test may be a viable option in the United States. It is in Europe to reach women who are rarely or never screened. And I do feel like we may be seeing an impact of the HPV vaccine on, once coverage is high, on precancers, which would mean that screening guidelines could potentially change, where women who have been vaccinated in the past at the right age could be screened less often.